Hi friends, I am Dr. Pratap Sinato. I have done MD in Forensic Medicine, and today we'll continue with Forensic Psychiatry, and that we'll discuss about impulse and obsession. Coming to first with the impulse. Impulse is a sudden, irresistible force compelling a person to do conscious performance of some act without motive or forethought. So here the person has some irresistible force. So which person has some kind of force where he cannot resist it, and he has to do some act because of that force. Here there is no motive and there is no forethought. So person doesn't think about that. He doesn't has any motive about that, and he does it without any motive and thought. This act. So there is a resistive force compelling him to do such a conscious performance without any motive or forethought. Usually, a sane person is capable of controlling an impulse. Sudden impulse, even a sane person may have sudden impulse to do certain things, but he may control it. But a person of unsound mind, having no judgment and no reasoning power, may do things on impulse without any forethought. They are usually seen in cases like dementia, acute mania, and epilepsy conditions. Some common types of impulse include common is the kleptomania, very popular type of impulse. Here, the person has a pathological compulsion to steal articles which may have little value or may not even be useful to the person. So here the person has irresistible desire, irresistible force compelling him to do steal things. So wherever he goes, he steals certain articles which have no little value, means there is no monetary value, or even it is not useful to him. He may pick up some things like a stealing. So here he has compulsion of stealing things without any forethought. Next is the dipsomania. Here the compulsion to drink alcohol beverages. So here a person has irresistible compulsion to drink alcoholic beverages. Pyromania, irresistible desire to set things on fire. The person has irresistible desire and compulsion to set things fire. Whenever he finds something, any items which he thinks which are flammable, he just sets them fire, which may be acts. Usually, two or more acts of setting a fire is done included in the pyromania without any motive. Next is a mutilomania. Here the person has a desire to injure or mutilate animals like domestic pets, commonly like cat, dogs. The person may try to cut off one of their claws, one of their fingers, one of ears, cut their ears, maim them anyway. So any form it may be done. So here the person has an impulse to do these things. Linomania is compulsive desire to shop. The person has serious desire to shop things commonly, where he may try to go to one shop to another shop to compulsion to buy some articles or just clothes without any control over his attack. Next is trichotillomania. Here the person has hair loss because of impulse to pull out the hairs. So person has noticeable hair loss caused by person's persistent and recurrent failure to resist impulse to pull out hair. The person has compulsion to remove his hairs, and because of that there is noticeable hair loss will be seen in the scalp. Next is suicidal impulses, where often seen in with associated with intoxication like LSD, which may lead to person to commit suicide, to attempt for suicide multiple times. That sudden impulse to commit suicide. Then similarly, there is homicidal impulse, where which it is also seen associated with certain chronic intoxication like cannabis, where the person may go in sudden killing spree, where the person suddenly may try to kill anyone who comes in way in front of him. Then sexual impulse, where the compulsive urge to perform sexual intercourse, which may often be perverted way. So the person has sudden compulsion to have sexual intercourse with any person, which suddenly impulse to do that act. So that is about impulse. Next, we'll discuss about obsession. So obsession is there is a person has some single idea, thought, or emotion in which is constantly entertained by a person, which he recognizes as irrational, but persists in spite of all efforts to drive it from his mind. So impulse has the person has irresistible force compelling him to do acts, but obsession is a way in which the person has some idea or a thought or a emotion. So it may be anything. Person may have some in suddenly person is sleeping, he has some idea, or he has some thought about something, or he has some emotion related to some situation like fear, anxiety, anything, which is constantly present in his mind. He cannot ignore that idea, and he recognizes it which is irrational. He believes that it is irrational. In spite of all efforts, he cannot drive it that from his mind. That's obsession. So that idea, thought, or emotion persists him, even though he knows that what is that idea is irrational or not true. It is a disorder of content of thought and is regarded as senseless by the patient himself. Here there is a sort of compulsive phenomena which is involuntary and ego dystonic. The ideas are usually associated with some sort of dread or fear. So the person idea is associates with idea is with dread, means if he doesn't follow that idea is because of some fear. For example, if the person like obsession of closing the door, even though he has a fear that some person may stranger may come to his home, the fear of that makes him to compulsion to check the door continuously. That is one form of obsession. The person experiences anxiety and control anxiety. He indulges in repeated acts, that is compulsive acts. One form of example is continuously washing his hands in fear of getting infection. So he may constantly wash his hands even though he knows that he already washed his hands. So that is also he gets anxiety if he doesn't do that act, and to control that he does the act. So that is obsession. The single idea remains in his mind even though it is irrational. An attempt to resist makes the person more insistent on that idea, leading to almost inevitable outcomes. So if we try to resist it, it becomes more insistent and it becomes inevitable. It is mainly seen in case of borderline between sanity and insanity. Common form examples include like a wife continues to believe her husband to be unfaithful in spite of proof of contrary. So here the wife is obsessed with the thought of that husband is unfaithful. So that persists even though she knows that husband is faithful. Even then, she believes that he has that thought is persistent within the mind, and because of that, she may constantly do certain acts to follow his husband and to hire some private institution to know whether the husband is faithful or not. Another example, like a person may go to bed at night after securely bolting the door of a room, but he soon gets up to see whether he has done so. A sane person may repeat it once or twice, but an insane person does not sleep, spends the whole night in frequently seeing whether the door is bolted or not. So this is one form common obsession where the person checks the bolts his room, go to sleep, again he gets up, checks the room, again he sleeps, and he does that throughout his night without with losing his sleep, without even getting a sleep. So that is the one form of idea persists in his mind that the door is not closed. That is about obsession and impulse. These are my references. Thank you.